During any election campaign, whether it is federal or provincial, politicians bring up the issues that voters care about to try to steer their platforms. But the most talked about and biggest issue for many Canadians has been off the radar in this federal campaign so far: health care. Seems to be a non-issue, at least until now. And news reporter Louise Hartland has the story.
How sustainable is our current healthcare system in Canada? Well, that depends on who you ask. In a report for the CD Howe Institute, former Bank of Canada Governor David Dodge warns Canada's universal healthcare system is unsustainable. In Ottawa, outgoing Esquimalt-Wanda-Fuca MP Keith Martin says this issue needs to be taken seriously.
Healthcare costs are growing at 7% per year, revenues at 2 to 3% per year. Simply is not enough money that governments have to pay for what we ask for.
Martin, a licensed physician, has actively supported adopting a two-tier healthcare system in Canada for years and says it's time for a change.
Because if we do not, what's going to happen is our patients, our citizens, are going to get hurt. And who's going to get hurt are those people who are in the poor and middle class, those of modest means.
But he says people automatically assume that would mean an American-style system. But he says we should follow a model farther away.
That is absolute bunk. What we have to do is talk about the facts. The European systems, 17 of the top healthcare systems in the world are in Europe. Canada is in the mid-20s. US is much worse than that. Let's look across the pond, let's look at Europe, look at what they did, and adopt those modalities here.
You know, the population is what it is. There's this bubble that's coming. You know, most people use their healthcare services when they're in their later years. And so, you know, the younger generations, you and I, are going to have to find ways to pay for it.
Conservative MP Gary Lunn says this is an issue all levels of government need to address.
We are putting more resources in, but I don't think you can just focus it on resources. You know, governments are going to have to all get together, provinces, federal governments, you know, the healthcare providers. They're going to have to sit down, and we're going to have a hard look at this, you know, as we move forward.
The Dodge report suggests the cure for the crisis could involve some unappealing changes, such as higher taxes, shortening the list of services covered by healthcare, and allowing for a second privately funded tier system, opening the door for anyone ready to pay more for better care to jump the queue. In Victoria, Louise Hartland, A News.